These are the 3 steps to turn back the clock on arthritis, stenosis, and disc degeneration in the lower back. What is arthritis and disc degeneration and stenosis? They're all essentially the same thing, and what happens is people who suffer with arthritis, with stenosis, or with disc degeneration typically have stiffness when they get out of bed in the morning. They typically have relief when they bend forward and more pain when they bend back, and that's why if you see somebody with severe stenosis walking through the grocery store, they'll be leaning forward on their cart as they're walking along, and what that does is that takes pressure, that relieves the pressure that's going on in their lower back. In more severe cases, it can cause incontinence, potentially, can cause pain in the groin, buttocks, down the legs as well, can cause numbness, tingling, a lot of different symptoms that aren't really pleasant to go through. So it can be extremely painful. If you took an x-ray of anybody in America over the age of 55, 95% of people over the age of 55 in America have some sort of disc degeneration, stenosis, or arthritis on an x-ray. And here's how it works. If you take a look at the lower back, so this is bone and this is bone, and your lower back consists of 5 bones sitting on top of your tailbone. Okay? So the most common level affected is L4, L5. And when they name disc degeneration or stenosis, they'll typically give it 2 levels. And here's why. Because the hole where the nerve comes out in the back, so this is bone, this is your spinal cord running up and down, so this is a huge giant nerve, and then you have these little nerve branches coming out in between each level of bone. Okay, so if this is L4 and L5, and that sits right on top of your tailbone, this is it's called a foramen, so they'll call it foraminal stenosis. Foramen simply means hole. Okay, so that's this area right here, and then you have a nerve branch coming out and obviously running down your leg. So what happens is with stenosis, this hole right here begins to close down. And usually when somebody has stenosis, they also have disc degeneration, and what that is this little space between the bones in your back, there's a disc here. And disc degeneration involves those bones getting closer and closer together and this space getting more and more narrow. Well, when that happens, that naturally closes down this foramen, the hole where the nerve root comes out, and that can create some problems. So what happens is when the person bends forward, that hole opens up and takes pressure off of the nerve, and when they bend backwards, or if they stand or walk for long periods of time, as is typical to cause increased pain, that will be more painful. Okay, so that's disc degeneration and stenosis. Now, arthritis simply means joint inflammation. So you can imagine if you're getting pressure on that nerve, or if you're getting closer and closer to bone on bone, the joint itself is going to be inflamed. Okay, so there are 3 different words, arthritis, disc degeneration, and stenosis, that all kind of mean the same phenomenon, the same condition. Okay, and that's what we're talking about. So step number 1 to turn back the clock is move. All right. So in studies where they look at people doing specific exercises, the very best type of exercise that you can do for arthritis, disc degeneration, or stenosis is simply to move. And the 3 easiest ways to move are, number 1 is walk. You have a pair of shoes, you have a pair of sneakers, you can go to the mall, you can go to Target, Costco, wherever it may be indoors, or you can go outdoors if the weather is appropriate, and you can simply walk. Okay, it can be on a flat surface, it can be on a slight hill or steep hill, whatever you choose to do. Okay, but walking is a great way to move. Another great way that a lot of people find beneficial is they'll do a bike. You can do an upright bike, you can do a recumbent bike where you're laying back and the pressure is off your back. Biking, both of those positions allow you to bend forward if you do have stenosis, and it allows you to take the pressure off of your low back as you're doing the exercise. And the 3rd most common one is swimming or aquatic classes. At least locally here in our area in central Pennsylvania, there are a lot of aquatic classes, whether it be at the Y, the Friendship Center, where you can get involved and do activities that take the pressure off of your lower back as you're doing them. However, whether it is walking, biking, or swimming or an aquatic class, How that works is, as you're moving, as you're doing those little movements, what happens is that the fluid that's in between the bones in your lower back, it has a chance to build up. So the more active you are, the more that space will increase, and also it'll prevent the stenosis from getting worse more quickly. Okay? So number one is move. Number two is think strengthening. Okay? So specifically as we age, we can become weak, and very specifically in the core. So the core is your stomach muscles, your deep abdominal muscles, and your lower back. Now you don't want to go out and do a whole bunch of crunches or oblique exercises. You're really looking for other exercises that strengthen your core. Usually they're found in Pilates or Tai Chi. There's some very low level exercises that you can do, and you can find those on our YouTube channel. And just look for top 3 exercises to strengthen your core, and we'll have 3 very simple low-level exercises that you can do to get started there. But you want to strengthen your core and your lower back muscles. When you do that, it protects your spine, and it prevents the disc from degenerating more rapidly. So when we see somebody in the clinic, typically what we'll do is help them get out of inflammation. Okay, so minimize the effects of the arthritis. That's the first step. And then the next step after that is to get them as strong as possible so that the effects of the stenosis, the effects of the arthritis, don't continually reoccur over and over again. And that brings us to the third step. The third step is for you to know what successful treatment looks like. Okay? So successful treatment for arthritis and stenosis usually has 3 components. The first one of those is hands-on PT. And in a second here, we're going to talk about what that looks like and how you can find the best hands-on physical therapist in your area. The second one is doing strengthening exercises. That are appropriate for stenosis and arthritis. There are excellent lower back exercises that have nothing to do with helping you with stenosis. So finding a physical therapist that understands and knows that and specializes in it is the key for you to get better. And the last part of that is traction. Some people might also call this decompression, and the mechanism is the same as an inversion table or traction or decompression. They run on the same exact mechanics and mechanical effect. But traction, what it does is it increases the space between the vertebrae, at least temporarily. We have found in our clinic that if we combine hands-on PT, okay, that's moving of the lower back and pelvis, with traction and strengthening exercises, people do extremely well who have stenosis and who suffer with pain and can't stand upright. We can actually, so somebody who's that severe where they're bent forward and they can't stand upright, we can actually move them in the right direction with the right combination of physical therapy and the right combination of treatment. Now, if you're not in central Pennsylvania, how do you find the best hands-on PT in your area who can address this? Here's what you do. You call to schedule an appointment, and when you do so, you ask if the physical therapist does grade 5 lumbopelvic mobilizations. If they say no, or if there's a stutter and they're not exactly sure what that is, and you find out that they asked the therapist and the therapist wasn't really sure, just call another office and keep looking. There's about 10% of physical therapists in the country are willing to do that. If you truly have stenosis and you don't have anything else going on, you're not going to need that grade 5 lumbopelvic mobilization, but you'll be in the hands of a therapist who understands these components and who understands how to examine you the right way and get you treatment that is truly going to help you. Okay? So they are the 3 steps to turn back the clock on arthritis and stenosis. Very shortly here in a couple days, you're going to get an offer from me for a free report on stenosis and arthritis and what you can do, along with success stories of people who have done really well using these and avoiding surgery and avoiding further injections. So keep an eye out for that, and until next time.